This is Dr. Cyrus Sebastian, consultant psychiatrist, and I'm making my third video of from the Couch series. In the previous two videos, I talked about some general well-being measures that we should all apply to help us get through the coronavirus crisis. In the second video, I specifically mentioned those with mental health conditions, and I advised them to get support and advice sooner than later. In today's video, I'm going to talk about some of the potential long-term effects of the current crisis we're experiencing. In particular, I'm going to highlight the WHO document that was published in 2011 that I've added as a reference to the bottom of this video on my YouTube page that you can all access. In particular, the impact of economic crises on mental health is significant, and the worry that I have is that one of the long-term manifestations of the current crisis, i.e. something we'll experience in the next months, perhaps years, will be more devastating than the number of deaths that we're having at the moment because of this. So I'm going to put the issue in perspective by just highlighting some data. 1 in 4 of us are likely to have a significant mental health condition in our lives. And the European Burden of Disease scale points to mental health disorders as affecting 1/3 of these problems. Half of the burden is because of non-communicable diseases, cardiovascular problems commonly, and that's followed by mental health conditions, in particular depression. And also in the UK, the commonest reason why men between the ages of 20 and 50 die is suicide. So the burden is significant and is likely to increase because of the socioeconomic and environmental factors and the economic cost of the coronavirus crisis. There's definitely a correlation between suicide rates and income inequality, and in particular what happened in the Soviet Union after its breakup is used as reference, and is often quoted that income inequality and economic collapse led to increased suicide, depression, and drug and alcohol misuse. So it's recognized that the poorest in society usually get hit the hardest during times of economic crises. And usually generally the more debt individuals have, the worse their mental health. Also, we have to factor in that the health resources of a country is dependent on a country's GDP. So if the country does badly economically, because the health sector is a percentage of the GDP, for example, in the UK, we're very lucky, we have a national health service. But if the GDP goes down, the amount of money that goes into the National Health Service will go down as well. So there's less money in the long term to look after the health and well-being of individuals in the country. The main risk factors here would be as follows. That those in relation to unemployment, including poverty, deprivation, debt, and job insecurity and job stress is linked into that. Another risk factor here would be abuse within families. Now, we've already received data that there's increased domestic violence in families because of lockdown. Individuals are forced to live together and to be together for longer than intended, and that has adverse long-term and shorter-term consequences in terms of violence, both verbal and physical. And also, I'm an addiction specialist, and it's recognized that during these times of crisis, both alcohol misuse and illicit drug misuse escalates. And we need to put measures in place to control that. So I'm going to talk about some of the sort of the long-term measures that I believe that should be put in place from now, and we need to prepare for from now that's going to hit us in the next few weeks and months, which is the next wave of the coronavirus crisis. So Economic measures need to be applied by the government to reduce unemployment, and also they need to have proper funded and structured debt relief programs in place. Also, the government needs to focus on family support programs to reduce abuse and also to support children during this difficult time, and ultimately to support families to prevent breakup of families. And also measures need to be put in place to control the price of alcohol, i.e. increase the price and reduce availability of alcoholic drinks, because that would most likely, that will definitely reduce alcohol consumption in society. It's an evidence-based measure. Public health studies have shown that with alcohol, if you increase the cost and reduce the supply, it's less likely to be abused, and we need those measures in place at the moment. And finally, mental health services need to be more fully resourced and certainly prepared for the mental health consequences of coronavirus pandemic. We're very lucky in the UK. We have a national health service that's we can all access. However, it needs to be better resourced. More resources need to go into primary care to deal with patients who present to general practitioners with depression, anxiety, suicidality, and they need to have access to secondary services for patients who cannot be managed in primary care to deal with, in particular, risk of suicide and drug and alcohol misuse that could escalate because of the coronavirus crisis as a secondary manifestation or the next stage or next wave of this pandemic.